I am Dr. Bharat Koyani, MD, pathologist, residing in Rajkot, Gujarat, India. Today we will discuss a clinical case of spurious thrombocytopenia. A 50 years old female patient was admitted to a gynec hospital for hysterectomy. The blood samples in EDTA and plain tubes were sent to a renowned pathological laboratory. All investigation except platelet count were normal. Platelet count was 63,000 per microliter. The gynecologist consulted the physician. Physician advised him to repeat certain tests, and the blood was taken in gynec hospital and was sent to another pathological laboratory. The MP by card and dengue by card were negative. CBC was normal except the platelet count. Platelet count was 70,000 per microliter. But when peripheral blood smear was examined, there were small platelet clumps on examination. Now the pathologist asked the gynecologist to send the patient in his own laboratory. The blood was collected in EDTA and citrate tubes. Pathologists previously thought that the previous reports of low platelet count may be due to EDTA induced platelet clumping. He tested EDTA blood and citrate blood, which was taken in his own laboratory, into the cell counter. The platelet count was 170,000, means 1,70,000 per microliter in both the samples. The smear showed no platelet clumping. After half an hour, he repeated the same thing in cell counter and peripheral blood smear. The same results were found, means there were no platelet clumping in the peripheral blood smear, and the platelet count in EDTA and citrate bulb tubes were 1,70,000 per microliter. He reported the same thing. Gynecologist hesitated and was not ready to operate looking at the previous low platelet count. Physician advised him to send the patient at home and after 1 week call her again. After 1 week, the same patient came into the laboratory and the CBC was carried out. The results were same as the previous one. The pathologist reported and the gynecologist operated the patient for hysterectomy. Patient was fine and sent to the home after no complications. Here we can see that when the sample was received from the gynec hospital, the smear showed under the microscope platelet clumpings, which resulted in low platelet count. Here, almost all the laboratories are using the cell counter based on the principle of Coulter or impedance technology. Here, cell counter measures the size of the particles, and when the particles measures 3 to 30 femtoliter, it will be counted as platelet. If it is outside this range, the particle will not be counted as platelet. Now, when there is a large platelet, means giant platelet, which measures more than 30 femtoliter, it will be excluded from the platelet count. When there is a platelet clumping due to any reason, the many platelets comes together and they will be counted as another, either RBC or WBC, and will be excluded from the platelet count. So platelet count in this condition also there will be a low platelet. Now third situation is when there is a satellitism, means the WBC or neutrophil is surrounded by the many platelets which are attached to the surface of the WBC. These platelets also will be excluded from the platelet count. These are the reasons why in some condition, even though the platelet count is high, the cell counter will show lower results. Sometimes They will also show larger platelet count. Here what happens? Sometimes RBCs are ruptured and they are fragmented. These fragmented parts of the RBC will measure equal to the platelets. So they will be counted as platelets. So here there will be a spurious thrombocytosis. Now we have seen that there are some conditions where we can see low platelet count or high platelet count. How can we confirm that our platelet count is not hazardous or it is true? Only by examining the peripheral blood smear, we can say that there is no platelet clumping or no RBC fragmentation and by or no satellitism of the platelets. By this, we can say that our platelet count is given by the cell counter is true. So, in each and every case, whether it is asked or not, we should confirm our CBC reports by given by the cell counter by peripheral blood smear examination. This is very crucial because false report may create a tension in the operative person or clinician or to the patient, and there the many investigations will be asked on this basis which are useless. So each and every laboratory should confirm or should screen their CBC reports given by the cell counter by examining the peripheral blood smears. Thank you very much.